Hi, my name is Christopher Cox, and for my second video I'm going to talk about shock and ACLS. Shock is a dose of energy given during ACLS. It is measured in joules. The algorithm for shock is voltage times current times time. There's two types of shock: monophasic, where we apply the pads to the patient and the electrical current for the machine goes from one pad to the other in one direction. Now with biphasic, it's a lower dose of energy, but it goes from one pad to the other, and then it reverses from the second and goes back to the first. Biphasic tends to be more efficient because it's a lower dose of energy, and we reduce the risk of thermal energy. That is something to consider because we don't want to harm the heart. Now, to illustrate that, just in the directions it goes, so we have here pad 1, and it goes in that one direction. Now with biphasic, it goes in that direction, but then it reverses back to pad 1. So that's just something to remember. Mono, one direction. Biphasic, we go 1, and then we reverse. Now, when it comes to the amount of joules that we use, with monophasic, we use 200 joules to 300 joules. With biphasic, we use 50 joules to 200 joules. Now, for unsynchronized shock, we use that in pulseless VTAC or VFib, and also in an unstable patient where the defibrillator fails to deliver a synchronized shock. Now, in synchronized shock, we use that for unstable atrial fib, atrial flutter, atrial tachycardias, and supraventricular tachycardias. Now, one of the things we do want to consider when we're delivering shocks is to make sure that we clear everybody from the patient who's getting shocked. So we want to clear that radius here, because if the machine is delivering a shock and I'm near that patient, I'm going to get shocked as well. So that's, injury. So we want to make sure we avoid injury when we're taking care or trying to help a patient. We don't want to create a bigger problem. Now that's my video on shock. My sources were the ACLS textbook provided by the American Heart Association, ACLSalgorithms.com. Thank you for watching.